Welcome, everyone. My name is Erica Grau, Director of Marketing at Rhinogram. I'm joined today by Dr. Austin Roberts, owner and provider of Family and Implant Dentistry here in Chattanooga, Tennessee. Today, we are presenting Using Teledentistry During COVID-19 and Beyond. Dr. Roberts has been an early adopter of teledentistry and is here to explain how your practice can stay engaged with patients during and after COVID-19. Just a few housekeeping items before we get started. We will send the recording of this live presentation out via email. If you have any questions throughout the presentation, please do ask them in the GoToWebinar control panel. We've saved time at the end to answer any questions, and we'll be sure to follow up via email or phone call with any questions we don't have time to get to. We'd love to learn more about your practice and how Rhinogram's teledentistry platform can make a difference in your organization. Email us at hello@rhinogram.com to speak with a product specialist in your area, and we will get you going. All right, Dr. Roberts, let's jump right in.
Thank you, Erica. Thanks, Rhinogram, for having me today and really being there for me throughout these past few years for my practice. Thanks, everybody, for joining me today and joining us. Hope you all are well. And it seems like there are a million opportunities to get behind webinars today. So thanks for taking the time to tune into this broadcast. I'm happy to be here and just share kind of what's been going on at my practice and how we're planning to kind of get ready to seemingly reopen things if and when we're allowed to. So having said that, we can just kind of hop right into things. I myself, I'll give a little bit of an introduction for myself here. I graduated dental school in 2011 and went into as an associate with a doc who provided sedation dentistry, did lots of different things, root canals, dental implants, dentures, all those things I wasn't necessarily anticipating on doing when I got out of dental school. But nonetheless, I got trained up to do those. He put me through all that. And after about 4.5 years with him, I got an opportunity to get out on my own, build my own building. And we saw our first patient starting 6/1/2016, of which Rhinogram was kind of just getting started as well. And I happened to come upon them and said, hey, can we just make this new landline number that we're doing a textable number for my patients? And sure enough, they were able to do that. And since then, we've been doing some teledentistry and quite a bit of it that's saving us things. So what's going on today with our practice? We got mandatory closures going on everywhere. So if you are doing anything, you're doing emergencies only. High numbers, cancellations, no shows because people are fearful of actually coming in. You're managing call volume. I guess, some folks may have their front office, one individual employed, up front kind of taking calls. And if you choose to treat emergencies, come in. If not, you're basically referring everything because it's either endo or extractions or, trying to triage this stuff. How do you do that? How do you manage that? It's pretty challenging to do just with individual telephone calls. Engaging with patients on current treatment plans. What was life like before all this hit, right? Just cruising right along and whatever kind of systems you have in place to keep things going and keep touching patients as they may have already left your practice and just keeping them engaged. We find with the teledentistry stuff, we're able to do that quite well and build some pretty flexible and cool systems to create a lot of efficiency around that. Along with doing things, communicating with staff members remotely. How's your team doing? I know me, we all kind of got together earlier this week for the first time in quite some time, and there were lots and lots of questions. They, of course, always can call me or anything like that, but for whatever reasons, everybody's got their own realities going on right now, and there's a lot of things going on. You may have families at home having to homeschool and all these different things. So nonetheless, engaging with those folks, Rhinogram also has something built in there where I can engage with them as well. It's pretty beautiful. So, and then limited access to office resources. So, how do you get there? What is your email only accessed in office? How about the phones? How about the file systems if you still have any paper files laying around? Or let's say your practice management software is a server-based location, so it's just sitting there unless you have any way to remotely access that stuff. It's kind of challenging. I myself use a cloud-based practice management software for just that reason, so we can keep things remotely. So what do you do now if you are seeing patients? More than ever, you want to stay engaged with your patients. That's basically the goal. Just let them know, hey, you're here for them. And that's in essence what my practice has done this entire time. We market yourself as the emergency provider. So even though, the appearance is publicly to anyone that may listen to the news and stuff like that, hey, dentists are closed. Well, we're actually marketing, hey, we're here for you. And if you got questions, just text them in from the comfort of your own home. The pre-screened patients send pre-visit instructions through HIPAA-ready text messaging. So since our office landline is a textable number, we're in a secure textable number, we're able to engage with these patients this way, and it's very easy for the patients. So they don't have to download anything or do anything like that. And there's no internet required. As a matter of fact, it's all through SMS. So even if your patient base does not have internet access, you can still do teledentistry with them. So that's a pretty beautiful thing at my office that we're able to maximize a good bit. And on top of that, what it allows you to do is basically triage every single thing that's going on. And that way you're limiting the amount of times that the patient actually needs to come in the office, because we can't really go in there anyways unless it's an emergency. But nonetheless, even your emergencies, I don't know how many people may have had this experience, but you go in for your emergency and the patient tells you everything on the phone that seems to qualify for an emergency, or whatever else. And you go in there and they've had a temporary crown come off, or something like that. And it's just kind of like, well, we really didn't need to cross-contaminate all this stuff and have all these touch points relating this visit when it could have been managed for that patient at home and without risking us having to go in as well. So nonetheless, encourage patient-initiated care conversations, whatever the questions are about all this stuff. You can do all this stuff. You can, get changing insurance information. I'll kind of show a little example of that later. You can do everything you do about your workflow essentially remotely. So kind of our team goal, just generally speaking, the way we look at things is, how can we minimize the touch points in our office and lean into this Rhinogram platform that we've got to do that? It turns out every bit of what it's got there allows us to do that. So along with doing that, the patient-initiated care conversations, if they got a problem, they're going to reach out. But we're also able to follow up, so we're able to answer questions and concerns well before the patient arrives or after we've gotten care to not have to do that follow-up visit, right? So the patient's in pain, it's a phone call, and they're just begging to come in there. Well, in our scenario, we're able to say, hey, can you shoot me a picture of that tooth, or whatever that scenario is? We'd be happy to have Dr. Roberts look at it. Patients actually very happy to do that because it's saving them time to actually come into the office. And then on our end, of course, we're able to save a whole chair and setting up and flipping a room. So I'll allude to the PPE and the efficiency stuff here later as well, but especially as we go through this COVID scenario, all these efficiencies that Rhinogram enables my office to have are really being highlighted more and more, and I'm continuing to peel back the onion layers of the flexibility of this system and what it allows us to do. What to do now if your practice is closed, if you're not actually seeing emergency patients? It's still important to stay engaged, because at some point in time, we're going to reopen. Every state, I recommend kind of looking to your state legislature bodies and state board bodies for advice on that. Market your services, follow up with prospects to ensure new patient flow when you reopen. Can you manage that now if your practice is closed? My office, we just simply are creating a list. We're able to engage with these people, have a conversation with them, not share care instructions, because that's a virtual exam that I would actually have to get involved with, and I'm happy to do that as well. But again, this is for if your practice is closed, even your front office or you yourself could be communicating with these potential new patients and making sure that, hey, yep, I'm here for you, and the second we know we can reopen, happy to get you in. Tools for remote workforce. How are you answering calls, emails, communicating your current situation to patients? It's important probably on your website and social media to really get that information out there. And then internal communication with your team. we discussed that earlier. It's pretty easy just to call them all up, but really when you're working alongside each other every day, you really get a lot of the nuance ironed out with the systems, and not having that currently, it's kind of tough. So how can you remain engaged with your team and lean into whatever this new normal is? I know within my own office, I've got folks that are very concerned about their own health as well, and understandably so, about how to do these things. So, leaning into and being able to do all these things remotely is really, really helping minimize these touch points. You also can organize your reschedule list digitally. So, inside Rhinogram, we can create a group, if you will, that a message can be transferred to, whether it's an individual person or whether it's a group. You can just shoot your message off that way and basically place the patient in a basket or a list, if you will. And so what we're simply doing is triaging all those by virtue of those lists. We have a clinical patients folder, if you will, or list. We have an urgent clinical patients list, and then we have a hygiene list. And once we're able to hit the go button again, we're just simply going to work through those lists, and you're inside the conversation already. So you just message the patient and pick up right where you left off. It's pretty beautiful. What does this new normal look like? I've been kind of alluding to it the whole time. It's leveraging teledentistry and virtual care to help flatten the curve of COVID-19, keeping patients and us safe. So the way to do this, you got to advertise on your website and social media. You're open for business virtually. Call or text us. That is literally our tagline. What we do, instead of little bags for each and every hygiene patient in the office, we actually have it printed on a 20-ounce plastic cup, a logo of our office, but it also says call or text us right around the rim of the cup with our phone number on there. And you wouldn't believe, we just get text messages in each and every day, it seems, with somebody that heard from somebody else. Word of mouth referrals, the absolute best thing on the planet, it seems. And they just heard from somebody. Well, what did they have to do to get that referral to them? Just share our phone number with them. And the new patient texted from the comfort of their own home saying, hey, I've heard from a couple of people, I've got this or that going on. And we're able to triage that remotely, and then only have the patient have to come in whenever they need treatment, which maximizes my chair production time, frankly, which is another thing we can get into big once we start really looking at what this Rhinogram thing does. Prepare for when this passes. How will you handle the influx of patients? Kind of been mentioning that with these lists, it's how do you want to triage these needs, right? That's been the hardest thing on me emotionally throughout this time, and I've learned to appreciate, and I've been humbled throughout it, is how many of your patients really do appreciate us. When we're going in and day out and just in the grind, and you get in your tunnel vision stuff, it's easy to lose sight because there are some patients that aren't so grateful, and that kind of weighs on you sometimes and whatnot. But frankly, all these patients reaching out to us during this time, needing stuff and not being able to care for them because it's not technically an emergency, it's been really, really tough. So being able to manage that and have that list just raring and ready to go for my team and myself to just dive right into when we can begin scheduling again, which our choice per our state, we're going to reach out a week in advance, but we're going to do that beginning this upcoming Monday to start filling our schedule back up. Teledentistry, it's a buzzword, right? You hear a lot of things about it. I got a feeling we're going to hear a lot about this stuff in the future. If you're not aware, there's actually an American Teledentistry Association, of which Rhinogram is one of their preferred dental platforms. I think it is their preferred dental platform, as a matter of fact. But I think they're basically just to advocate for the advancement and usability of this ultimately for civic needs and everything else. Again, I alluded to it earlier with there's a lot of these live video things that can be done. Rhinogram is working on that as well. But what we found with that is not everybody has access to a camera or to the internet, especially in rural areas. And so they all have a cell phone and can text message. And so what we have found is we're not, having to limit our practice to any specific segment. We can get our message out to everybody and engage with any and everyone that we wish to. Teledentistry covers a lot of broad things, and you've probably been doing it in your practice to some degree already. The challenge is managing all of these events, and that's where Rhinogram comes in and really just assists with things. But teledentistry, it's the use of electronic information, imaging, and communication technologies, including interactive audio, video, data communications, which would be considered text along with other things, as well as store and forward technologies to provide and support dental care delivery, diagnosis, consultation, treatment, transfer of information, and education. That's what's going on. And you're probably already doing it. If you've ever sent a text message of an x-ray to another office because they needed to get to a referral office, or if you've ever sent a text message to a patient, even though it's, you know, through non-compliant ways, you're engaging in teledentistry. If you've ever sent an email, a secure email or an unsecure email, that is teledentistry. Some people are even arguing, and it's interesting in the field of medicine, I don't know if we'll see this in dentistry yet, but some people are arguing, and it seems like the Center for Medicare and Medicaid Services is actually paying for a phone call, because a phone call technically is a remote service that's done. And so if the doctor is giving information via a phone call, some are arguing that that should be covered under this teledentistry thing as well. But basically any and everything that is remote and able to do things without the person having to be face-to-face could fall under this teledentistry classification. So even having been doing this for 4 years now, we are still learning all the different ways that we can deliver care more efficiently and effectively to our patients. And when I say deliver care, it's not necessarily the drilling that you may be thinking of chairside. We're still going to be doing that, absolutely. What we are maybe no longer doing is the chairside consultation, because that thing is happening before they ever get to your office. You can talk cost, you can talk treatment plans, you can talk insurance information, you can talk whatever you need to know and get all that piped up before they ever even come in. Now, of course, without x-rays, we can't diagnose anything, but we sure can talk about what we know. We can't talk about that patient, but we can educate the patient, which is what I have used pretty well in my practice, and that's minimized the amount of chair time we need for these exams. And that way, when the patient comes in, if they need a root canal, well, in my office, we do root canals. So we've already decided that. Do they want to save the tooth? Do they not want to save the tooth? Generally speaking, you know, and then we confirm that with an x-ray when we get to the office, but the patient's already educated, so they're ready to proceed with treatment that day. It's pretty nice to be able to do that. And teledentistry is how we do that, and managing that appropriately. Security is so important, and that's why I put my trust in Rhinogram and these telehealth platforms, because they are doing just that. So, you know, we go to this new patient onboarding, which is a whole new segment to think about. How does a new patient get into your office right now? Think about every step that takes and all the efforts that you have to try to get that patient to call your office. And then they do, what happens? Well, my front office, if they're engaged in a phone call, they cannot multitask whatsoever. Whereas when we got text messages coming in, we're not tied up on a phone call. So if there happens to be a person in front of my front office individual, they can engage with them and make sure their experience face-to-face is as beautiful and undistracted as possible, all while giving great service to however many people at home. My front office says she can handle about 8 conversations in Rhinogram to one phone call. So you see here, you know, their dashboard. Anything new is just going to come somewhere on this left dashboard. The beauty is all of these different groups and lists, all of this is creatable by you. So however you want to create your workflow for all this, Rhinogram's flexible enough to allow you to do it. So that's the beauty of it to me, is we are constantly changing our workflows, because COVID is changing them for us, unfortunately, but it's happening. And by virtue of that, we've been able to change some of these boxes we've been able to change some of these lists and then really create better systems than what we originally put in place, say like a year ago or something like that. So what you can do here, you see there's this patient messages column. All your patient messages are going to appear here. And we can see in this example, Johnny Smith has messaged in, here's my new card. How many times does that happen? Somebody, you know, if you take insurance, it's usually employer based. And how many times does an employer change their insurance? You know, seems to happen every year for certain employers around where I live. But nonetheless, we're able to manage that and field that from the comfort of their own home. My wife's on this plan now too. Keep in mind, the wife's not a patient yet. Well, he kind of just asked if the wife could be a patient, and we've got this information. So how quickly and easily can we onboard this patient now? And then basically just get to the helping patients like we want to do. And of course, you do this right here as well. Whatever kind of conversation you want to have at it. As long as the consent has been granted. Rhinogram does a great job about really training all the team members of how to go about doing this, because what you'll find is there's all kinds of conversations that are being had. Same thing with a phone call, right? How do we go about doing those conversations though? Sometimes we got financial conversations. Sometimes we got PHI conversations. Other times it's just general information. General information we can share anytime. But as you see on this bottom right side, you get a little clip of some of the consent management that Rhinogram has in each patient profile. You can see that Johnny's consent was granted at some point in time. And so that's great to know. So now I know I can engage with him about these things. But I can also simply send this message to my financial person if it were to have to come to me. So I just simply hit a couple of buttons and it goes straight to my front office if she wasn't responding to this already. Then you see just a little bit lower on this left-hand column here, all of our internal messaging. So we don't have to leave any interface or anything like that to actually talk with someone. And the same concept, these patient messages where you can just create whatever groups you need, the parameters around whatever groups and workflows. You can do the same thing for these team messages, and it's all secure. So for example, when I see something come through and it's something I need another staff member to handle, and it has patient health information in it, I can simply assign that message over them or chat them directly, letting them know, hey, Johnny Smith, his information is such and such and such and such, from the comfort of my own home. Whereas prior to me having Rhinogram, the way I had to do that was simply just text message my staff member the way I maybe call them all the time, right? However, that's not compliant because I've now got Johnny Smith's PHI inside my phone and inside my staff member's phone. So being able to take that and get the security of all that was just really, really big for my practice. So we can just do what we want to do, which is providing care for our patients. Again, this COVID scenario, it's just been so humbling about being a provider for care. Patients really, really do need us out there, guys. You know, I hope you've kind of felt the same. I'm so raring and ready to get back after it and just do dentistry again, get back to helping people. I didn't realize or maybe took for granted emotionally how much that meant to me inside. But we've been able to continue doing that, really, you know, from home for the emergencies only, right? Here's an example of that. I'm in a lot of pain. I just can't take it anymore. Can you help me? Hi, this is Stacy. I'm sorry to hear you're in pain. This is, by the way, a screenshot of what the patient's phone would look like, or the dental practice's phone. If maybe they were inside Rhinogram, it would look a little different inside Rhinogram. But nonetheless, you see the same conversation. I'm so sorry to hear your pain. Can you take, this actually is the patient's phone, excuse me, there, and they have the dental practice as the stored number in the phone. So sorry for confusing anyone on that. Inside Rhinogram, you just saw the previous screen. It would look just as it did in the previous screen. So here's a picture of the patient. Hi, I'm in a lot of pain. I just can't take it anymore. Can you help me? And then a response from the office. Hi, this is Stacy. I'm so sorry to hear you're in pain. Can you take a picture of your teeth and text it back? I'll have the dentist take a look at it right away. How simple is that for Stacy at the front office to do? Very easy. And she did it from home. She just like you get a text message notification, your Rhinogram is going to notify you as well on your phone that, hey, this patient's messaged in. So you now see Stacy has responded and requested a picture. Patient sent in a picture, and you can see it looks like a crown has come off. There's, maybe some endo done here. I can quickly kind of assess this without diagnosing technically, right? But an x-ray, of course, is always going to be very, very helpful with this when we get them into the office, if we need to get them into the office. But with this, you can see, well, this crown's come off, and there's not much clinical crown to left with to actually get a crown to stick on there. So what do you want to do with that? And you can go ahead and talk through the options and the possibility of this patient either wanting to save or remove their tooth. And then by virtue of that, if they choose they want to remove the tooth, they never even need to come into your office, which limits the amount of PPP you need, which limits all of that along with the contact points and saving the patient as well, all the contact points, potentially spreading this COVID deal. And you just refer them right to the oral surgeon if you don't do extractions yourself. Or if you do extractions yourself, you go in and you know exactly what you're doing. You're able to prepare for that. And so that kind of shows you a few of the different things you're able to do with this. And then we got a couple of these bullet points that kind of give that an example, right? Here it is. My crown fell off. Hurts every time I eat. Please help. We can probably assume there's a little recurrent abscess, underneath an endo treated. So all Stacy did at this point inside Rhinogram was assign this message to her doctor, which is Dr. Green. 2 clicks. Then Dr. Green's got a notification on his phone, which he's able to see this entire conversation. Stacy responds back though, Dr. Green's going to prescribe you some ibuprofen to help with the pain. We'll have him take a look at it in the picture when he can get you in. Thanks so much. This happens all the time in our practice, and it saves us. The patient experience is beautiful. They appreciate it so much. I can't begin to tell you about that. Managing the pain at home until the next available appointment is efficiency for the practice, but also the patient really, really loves just being able for you to talk them down off of the ledge that they were on when they needed to talk to somebody. You're also able to triage these issues and see the highest acuity first. So say we got a few of these scenarios going on and you have minimal chair time. Well, how do you manage that? Rhinogram gives you the ability to flex that around however you might wish. There's probably a bunch of different ways. Each and every practitioner would like to go about doing things and triaging things, different opinions about what's truly an emergency and not an emergency, and what do they wish to do and not do. Well, Rhinogram allows the flexibility of every single bit of that, which is the most beautiful thing I like about their platform. I'm constantly kind of pushing myself and my staff to see how we can't make it even more efficient in the office without sacrificing any of the clinical care that we want to give. So you're also able to gauge your need for supplies, PPE, imaging and tests before the appointment. So we message the patient before they ever even come in during this emergency time and say, hey, have you can ask them the questions. Have you had a temperature? Have you had a cough? Have you been out of the country? All these things that we've been told to ask. You can also go ahead and share forms with people. You can go ahead and just text them the form, say, hey, here's what it is. If you want to print it, fill it out, be my guest, but here's what's going to be asked of you when you come in. At my office, I think it's very good practice currently to go ahead and get patients, if you are seeing them in any capacity, to actually sign a consent form saying they have not done these certain things. And that's what we've been implementing, and they basically can't get through the door unless they've got that signed sheet of paper. So we've also pushed our parking lot to the waiting room by virtue of this, which is something I haven't really hit on a lot. There's just so many efficiencies that this platform's allowed to do. It's hard to kind of wrap it up into a ball of wax for everyone. But ultimately, it's the platform that allows you to manage how you do your teledentistry stuff as you're learning about teledentistry. I've been doing it for some time, and I didn't even realize, for example, the PPE efficiency. I don't audit all my PPE, so actually itemizing how much our ordering is. I keep, of course, seeing the cost, but somebody else orders it, So my inventory management of that, as far as auditing, is almost non-existent, because it's just too much to manage, frankly. Well, how do you go about doing this stuff? Now we can just do all this from home and limit the amount of PPE and all that stuff. So it's absolutely wonderful to be able to do and get all that stuff done before the appointment. How do you go about marketing your practice? I mentioned that earlier. We're still here because there's an ad of mine that goes out there. Continuing to serve the community of Ottawa. It's actually a suburb of Chattanooga, just in case you're not familiar with the Chattanooga area. Southeast Tennessee, generally speaking. Call or text for an appointment. Text us for virtual dental consult. Advertise you're open. Have you cut your marketing budget or any resources there? Leverage your staff to start posting on social media. So we've been telling our staff, hey, just come up with a video once a week from home, just saying hey to everybody, things like that. You can also update your website regularly with instructions on how to contact you and requesting a virtual consult. So you'll want to kind of build what the fun part of all this is when you think about a virtual consultation. You want to build an experience for your patients around this. What do you want that experience to be? Because it's virtual, right? So what language do you want to use to actually pipe up that, hey, I'm gonna get this message over to Dr. Roberts, and when he'll take a look at it, and that's your virtual consultation. We've actually had patients ask us that very question. How do I even go about doing a virtual consultation? Right there in the text message. And we're doing it already, except you're not talking to the doctor. So I'm gonna send this message over to the doctor, let him know, and then he will begin to engage with you just as we are already. And that's your virtual consult. He may ask you for a picture, he may ask you for a video, but you'll just chat. It's that easy. After COVID-19, what's going on after all this? It seems like there is a light at the end of the tunnel, which is wonderful. We've been using universal precautions for a long time. There's a wide variety of opinions about to what extent will those impact our practice. I feel like it will be at least more than what we have already been doing to this point prior to COVID. Let me just say that. So generally speaking, how do you make your patients feel secure and safe? Well, we minimize the amount of patient touch points, and we educate our patients that that's how we do it. We send them a message simply stating, hey, when you arrive, please stay in your car. We'll have somebody come get you, and they'll open the doors for you so that you can walk right back to the operatory without having to touch anything but your feet to the floor. Patients are very appreciative of that. Does your new workflow include offering waiting room alternatives? Just mentioned that, making the parking lot the waiting room. Seems to be working well for a lot of people. It's not only about protecting the patients, but it's about protecting your staff and yourselves. Do you have a backlog list? How easy do you manage that, right? I mentioned that earlier. All this list of when we can hit go again for elective stuff, or whatever they determine to be elective stuff, what does that look like? How do you manage that list? Do you then have to, if you have a list of names, do you then have to look up their phone number in the practice management software and then call them? Or if you're, I know there's been new rules where they've laxed some of this HIPAA stuff during the COVID outbreak. I would definitely say that is not a ability to go wild west. I would still advise that you go about doing things as best as possible to protect your patients and yourselves. And so really it's all about the security here more than anything. But how do you go about managing that list? Even in that scenario where if you're just using your phone to, talk to your patients, you still have to go look up their number, and you still have to engage with them there. And then you have to record that somehow, I guess, maybe back in the practice management software. Well, my list is already inside where I'm talking to the patients. It's inside Reimbursement. So we just go to that list and start working our way through it. Each and every patient is there. We just pick up right where we left off. And the goal is to clear out that list, right? So they don't have to go look for the number. They're just right inside there already, ready to chat with the patients. And since it's usually the same message, we're sending to the patients. Rhinogram also gives you the ability to template things. And so if you find that, you have common language, which is actually really nice to have because you don't want your staff giving any, advice out there, anything like that may not be representative of how you truly practice. So you can create these templates, and then you just have your staff say, hey, title the template, this is scenario X, or whatever, and they do it. So we have a template, for example, of arrival instructions. We also have a template of when COVID began, COVID-19 message of having to tell people, well, this is indefinite. This is an indefinite hold, happy to treat you for emergencies, but other than that, we're putting you on a list. It's worked really, really well. We're piped up and ready to hit the go button again outside of this emergency stuff that we're already doing. And what does that look like? I'm thinking myself that perhaps other Rhinogram users that may be more creative than I am will find even different ways. And Rhinogram's got a super user forum where all the users can actually chat about things and how they're going about using things. And that's another aspect of this that's super helpful. So we just chat about how we do stuff in there, and then everybody's able to learn from one another, what maybe works best for you. And as I'm sure every dentist knows, what may work best for you may not work best for the person right next to you. Doesn't mean they're wrong or right. It just means that what's works best for them. Well, with the platform to allow you to do teledentistry being flexible, you can create it however you want. That's what Rhinogram does. Here's a little video of the CEO, Dr. Keith Dressler. He is a practicing orthodontist in Chattanooga. I'm actually know the guy, and that's how we got connected early on. He is in the Chattanooga area as well. And Dr. Dressler is an orthodontist, been doing virtual consults remotely, seeing a lot of things. If any practices do ortho, you can absolutely do virtual consults through this platform, along with remote patient monitoring and follow-up exams. So think about the time saved if you can do your 4-week evaluation, if you're doing any kind of clear aligner therapy for your patients, if you're an Invisalign doc or anything like that, you're able to do these follow-up exams at home. And what Dr. Dressler's doing is simply just mailing the patients once he is approved. They send in photos of the smile with the liners in and with the liners out. It's all from the comfort of their own home. And frankly, it's all from the comfort of Dr. Dressler's own home. And he can see and go, yeah, you're ready to move into the next set of aligners, and just mail them the aligners. Patients don't even have to go into the office for that visit. So back to this concept about, just minimizing touch points. Seems like COVID's really, really driven that to such a degree where now not only are we potentially interested in doing that, but our patients are willing to adopt any measures to do that, which has been most helpful in receiving these new changes of workflow. Sorry, I can't shake your hand when I come into the office, keeping things like that up. Well, patients aren't frustrated with me that it's got to be that way. They know I'd rather not have it be that way, but they're willing to accept some of these new normals. And I think what we're going to find through these new normals is we actually want to keep some of this stuff in place. Let me see if we can get this video to play for us here from Dr. D. I'm not sure I may be able to. I may have to ask Erica or something how to go about doing this video.
So it looks like it's not going to play in the presentation, but we'll be sure to send that out to everyone after.
Okay, perfect. Having seen this video, I can share with you that this is Dr. Dressler. He is doing a local news interview at the very beginning of this COVID scenario, basically just talking quickly about how his practice is leaning into Rhinogram and what it's doing for his practice. So we'll make sure and get that out to you too, so that we don't have you hanging and waiting on what Dr. Dressler's words might have been there. So at the end of the day, I kind of want to just wrap this up just a little bit. I know there's a million webinars going on, so I don't want to be just rambling along here. I could talk about what Rhinogram's done for my practice just so much, but And I'm happy to chat with anybody who wants to talk about what Rhinogram's doing for my practice. Feel free to contact me. Ask Erica for my contact number or anything like that. I'd be happy to chat with whomever may have questions, even beyond this Q&A. Your practice can deliver high quality care by leveraging teledentistry now and after COVID. That's really what I'm beginning to focus on most now. What does life look like after this deal? Stay engaged with your patients through bidirectional text-based communications. They want to hear from you, regardless of what the message might be. They want to hear from you now because they've got questions. Or if they're already existing patients of mine, they know because I've educated them in office and through experience. If they have a single question ever, they need to simply just text me. It's that simple. We say, we are your tooth consultant throughout your journey of life. And that's generally what we do. And then should the patient choose whatever treatment option may be best for them, we're happy to make that happen and are pretty darn efficient at doing that in office. But the tooth consultant portion, I'm beginning to think it can happen more and more and more remotely without actually having to come into the office, but to confirm a diagnosis. Pre-screen patients. You can send pre-visit instructions through HIPAA-ready text messaging. Super easy. Everything about the workflows that you may have in your office, there are 10,000 ways to skin that cat. There are consultant groups all over the place letting us know how to do this stuff and what works best for these scenarios and those scenarios. And whichever schools of thought you subscribe to on any of that, or if you don't subscribe to any at all and just go by your own, you can plug that right into Rhinogram because it's flexible enough to assist those workflows via virtual care. You can answer questions, concerns before the patients get there. So again, when I'm seeing patients, I'm really not talking to them. I'm not spending time educating them. I'm not spending time doing consultative stuff. We are taking an x-ray to confirm which one of the options the patient is going to go with. And then the patient has already chosen. So we've already talked money. We've already talked insurance benefits, all before the patient even gets there. And that way, when they are there, they're getting their work done. So my office got a lot of open chair time, but that's not actually a bad thing. We can work anybody in that knows that they want to get treatment done. And that's how efficient we are. It's just wonderful. Leverage this platform, streamline your practice's unique workflow. Can't say it enough, guys. It's just super flexible. So however you like doing your dentistry and delivering your care, set it up to do that. And Rhinogram and their customer success people are going to help you do just that. If you can't find that happens, which it's going to happen, you can go to the super users forum and chat with everybody about it. It's pretty nice. So appreciate all the time today. I'd like to drop this back over to Erica, I guess, for the Q&A. Happy to answer any questions that anybody may have. If anybody has any questions about the Rhinogram product itself, like I said, I'm happy to share my experiences with the product. Disclaimer, I'm not getting paid anything from Rhinogram to do this lecture. I am an advisory board member of theirs, but this is just out of the goodness of my heart for what dentistry and the future of dentistry I see becoming, trying to just help educate everybody out there and make sure that our profession, which is duly needed, survives and is just the best thing to be able to offer for the patients that are out there for the future. So, Erica, thanks for the time today. Everybody else, thanks for listening. If you're listening to the recorded edition of this, thanks for the time whenever you're taking it. And yeah, Erica, have at it.
Perfect. It looks like we have a few questions, a couple lovely good morning messages. So good morning, everyone. Thanks for joining us. It looks like we have a message from Steve. He said, I joined in late. Will you be sending the recording? Yes. Just a reminder, we will send a recording of this live presentation out to all of our listeners. So if maybe someone on your team may have missed this presentation, you can be sure to send them that recording as well. We have a question for Dr. Roberts. How do you get team buy-in when asking them to help participate in marketing activities like posting on social media?
For me specifically, I'm one of the few docs, I guess, who chose not to consider that unemployment side. For my team, I said, you know, if we all go down, we're going down swinging. So I continued to pay them, and they were basically just sitting at home. So everybody kind of felt guilty after about a week of sitting at home and getting paid. And that was a big help for my buy-in there on the social media stuff. Um, you know, really engaging with the patients directly outside of social media has been super efficient for our practice. So we use a boutique marketing firm that comes up and I just deal with directly to come up with like the Facebook advertisement that you saw earlier in the lecture. But my team specifically, they are, I guess I'm 34 years old. All of my team is my age or younger. That's not by design per se, but that probably does affect some of the buy-in. But you just got to make it fun. You know, I mean, just philosophically, I believe we're here for the patients. That's the only reason we're here, right? That's why I went into dentistry, to help people. And so I really preach that to my team a lot. Being able to streamline things through a platform like Rhinogram allows, we talk about working smarter and not harder all the time. And so just being a leader in that capacity, I feel like helps when I actually do ask them to do something for me, rather than just giving them the autonomy to go design whatever they want and then we review it, is well received because of that kind of, I guess, leadership. Does that answer? I hope that answers your question there.
Perfect. Looks like we have another question. How long would it take to get this set up? We might be opening next week or in the next week or two.
Erica, do you want to
I can
take
def
that
I
question?
can answer this. Yeah. So we have a world-class customer success team. They are working around the clock to get people set up within hours. So we have another question. Does this platform integrate with Dentrix or is it separate? So we have a long list of different PMSs that we integrate with. I can definitely chat with you offline to talk more specifically how that integration would work and kind of what information could be shared with Dentrix. Great question. So we have a question for Dr. Roberts. How are you billing patients without insurance for your time? I know it's a value added service, but as this gets more and more popular, what is it going to take more and more of your time? I know that some telehealth models have a $25 fee just for the consultation. Not sure how to address getting paid for our time because our time is valuable.
Thank you for the question. That's a great question. Currently, it's the federal mandate seems to allow states to go by whatever rules they want to create now, which is encouraging. It seems to be on a state by state basis. And there's actually some information that American Dental Association shared, I believe about a month ago. So it's probably been updated since. That's got some insurances that are hopping onto this. At the end of the day, it is an ever-changing, seemingly by the hour, deal with the insurers and them wanting to do reimbursement for these telehealth services. I will tell you that right now, because the experiences are so new, it's not going to be from this aspect, like you mentioned, of getting reimbursement. You're not going to see a ton of that now. Now, I believe completely that in the future we will, because we've got Center for Medicare and Medicaid Services paying physicians for talking on a telephone. So I think it's simply just a matter of time before a lot of that comes around. The fact that these are so new, it's like building the actual experience of a virtual exam. Is it the second I start engaging with a patient through text rather than another staff member of mine, technically I could charge for that. So if you want to, you absolutely could. Whatever your code might be, it's usually a limited exam code, DO140, or something to that effect. And if you are dealing with insurers in our state, we've tried filing a few that we've been doing. Haven't gotten a response back yet, but we have documentation of the event, which I would tell you if you are going to be submitting any claims to insurance, you would want to document the encounter. And good news is Rhinogram is uneditable and a permanent record. So all you do inside Rhinogram is select the few lines of conversation or whatever it was, and Rhinograms allows you to export that as a PDF, and you would simply send it along with the claim to the company. So even though things are still getting fleshed out as far as reimbursement goes, and really this entire experience, how do you wish to create it is what I would, I guess, tease you with as a response to that question, is because it's a great question. The last thing we want to do is spend, an hour and a half of our time here and there, engaging with a patient and not getting paid for it, right? But here's what's happening in the long run. My engagement with that patient, however minimal, even just a touch point, is one, civic duty to the patients that we have, but two, is also building trust with the patient. So they're going to come to you, and whenever they do see me, instead of just a limited exam and education, they go, oh, well, I'll think about it or whatever, and then I may or may not ever see them again. The day they come into the office, they're getting their treatment because we've already talked about it. So I can see where indirectly this is an enormous moneymaker for my office. But as far as reimbursement for the virtual exam currently, you are able to set it up and you can charge people however you wish to do that. I think, $70 or so for a limited exam. I don't know how much insurances are reimbursing with those, but you simply just attach a teledentistry code along to that limited exam if you performed it through teledentistry. I think it's like a D996 would be the code for what they call an asynchronous encounter, which would be more of the store and forward or text message style of encounter. If you do a live video with a patient, that would be considered a synchronous encounter because both parties, the patient and the doctor, have to be present at the same time. It's not a store and forward model. It's more of like a real-time encounter. And I think that's a D995 teledentistry code. You simply just add that along with the claim to submit to whatever insurance provider you're wanting to, or if you're fee for service entirely, you just set it up and get your consent for the exam prior to you, the doctor, engaging with it. Just have your staff talk about whatever, use whatever language you want. Say, hey, when I hand this off to, I'd be happy to do that virtual exam for you. The cost of it, such and such, da 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 da. And this is assumably your front office speaking to the patient at this time, or whatever other staff member you have. And then the second they assign it to you, that's your virtual exam, and you're simply engaging with the patient for however long you want to. Then, so usually for my case, I see a picture, I can very quickly triage, figure out what's going on, go, okay, it takes me 2 minutes to figure out what's going on, and then assign the message, engage with the patient, let them know, yeah, we're gonna get you antibiotics, we'll get you scheduled for the emergency or not scheduled for the emergency. In 2 minutes of time, then I simply shoot the message back over to my front office, who completes the rest of the visit out. So, I equate this in somewhat of my mind to, whoever would be doing your on-call service at your office would be doing your is who you would want to be doing your after-hours stuff, and then just simply forwarding you the messages when you have a payable consult. And then 2 minutes of your time, $70, and then they're actually on your schedule next week for root canal or crown or whatever, especially post COVID. That's exactly how I can see all this stuff working. Great question though. That is absolutely an area that will be dissected very critically over probably the next few years. But I'm encouraged by the legislative bodies of what we see to show that they are willing to reimburse for these telehealth services.
Great response, Dr. Roberts. Just to add on to that, Rhinogram also offers a text-to-pay solution. So if you're interested in, billing for your virtual time or billing for those online visits, you could use Rhinogram to facilitate that payment as well. So I know a lot of people, we've seen a lot of our customers have concern about when they open the offices back up and how are they going to keep their offices safe and clean and, sterilized, if you will. So instead of having like a bring your own pen policy for patients to, sign the point of sale or whatever it may be, you could facilitate any kind of payment transaction via text with Rhinogram as well, which I think is a great value add, especially in this social distancing era that we're in. We have another question. What pa Let me just read this really quick. What number are my patients going to be texting me on, and are they using an app?
Great question. The number they're going to be texting you on is the same exact number that you tell them to call. It's as simple as that. I've always believed since I got in practice that that number should be the same. It is part of our brand, if you will. And when I was an associate with my first employer, we did a lot of external marketing, and a lot of those external marketing companies would attach their campaigns to a specific number that was not our office number. And I, for the life of me, was going, why? We're confusing our patients. It's like giving them the wrong address. But technically speaking, in order to follow the campaign, right, you got to, and then for them to be able to show you ROI on that marketing campaign, they want to quantify how many leads that generated. So that's in essence why they do that for you. Well, but again, that doesn't defeat the principle at hand, in my opinion, right? You want the same number that is your office line that you tell people to call or text, that you market to everywhere, that you tell them to call, you're also now able to text. So short answer to your question, the same number that you are already hooked up with that people call that you market for, that's now a textable number. The second part of that question was, do the patients have to download an app? The answer is no. The patients do not have to download an app. That's one of the beautiful things. It's one of the most beautiful things about Rhinogram. They do not have to download an app, and I think it's something like 30% of the country does not even have internet access. So if I'm wanting to do teledentistry with them, how am I going to do that if they have to download an application? They can't. Well, they can text message though. I think there's some technical stuff with what's called a SMS message versus a MMS message. But nonetheless, Rhinogram enables both of those, and that allows you to get to all of those people without them having to download a single thing. Just like they call or text their family, they can call or text you, and it's already happening.
All right, so it looks like we have just about 2 minutes. We have a few more questions, but do not fear. We will be sure to follow up with everyone via phone call or email with the answers to your questions. We have one more question that we could probably squeeze in the last minute. We have a system now that texts our patients for appointment reminders, but patients can't initiate text to us. Can the patient initiate the text or ask us questions without texting them first, without us texting them first?
I'd be happy to take that. We have it happen at my office all the time, and Rhinogram absolutely allows not only existing patients for you to do all these teledentistry services with, but new patients, people you don't already even know. So I alluded to it earlier in the lecture just a smidge, but I didn't quite define it well enough. Again, all these experiences, they're virtual. So it's kind of hard to conceptualize in your brain because we're so used to physical experiences. But I equated it to my staff the other day, and like saying where all these Zoom calls, somebody's on the call and then something embarrassing is going on in the background, type of thing. And my hygienist had a call the other day, and her 4-year-old son was in his underwear, and came and hopped on her shoulders, and she was mortified, that type of thing. Well, That in essence is kind of like what we're dealing with here. You were doing a professional thing where you had to be clothed and put together for whatever it was you were engaging with the Zoom call, right? As a business. Well, same thing with all of these teledentistry services. They're these new experiences that may not be physical, so they're hard to kind of think about in your head, but they can actually happen, and we just got to flesh it all out. Rhinogram's platform for that, because they allow the flexibility for us to explore any and all ways of these deliveries that we want to. And being at the very beginnings of all this teledentistry stuff, I'm just most excited for what we're going to be able to provide for our patients in the future there. Did that get to kind of, I think it was the, new patients, not new patients, right? So it is as simple as your tagline for your office. I mean, there's no gimmicks to the sales pitch or Rhinogram when they say this. It is truly, your number is a textable number. Patients don't have to download anything. They don't have to do anything but call or text you to engage with your practice. And we find our phones hardly ever ring because most people prefer to text us.
Yes. So the answer is yes, patients can initiate. So someone who you've never seen, someone who's not a patient, can go to your website, see that you are textable, and reach out to you first. And then on the appointment reminder side of things, what's really nice is a lot of other companies, they offer appointment reminders with, type yes to respond, type no if you can, if you're, yes to confirm. And what's nice is a lot of time people respond to those messages with, their daily problems, like Dr. Roberts was saying, of like, I'm having car issues or I'm going to be 5 minutes late, uh, which those might not ever get to you, if you can't respond automatically to those appointment reminders. So it looks like, Dr. Roberts, if you're up for it, we might have one more question. Would you be down for one more question?
Fire away, man. I got all the time y'all need.
Okay, so we have one more question, and then I promise we will wrap this up. Um, you said you can text or send messages with Facebook. How is that HIPAA compliant? How are you using Facebook? We have tried, but it ends up being more work to try and monitor all of that.
That's a great question as well. I believe that a Facebook business page is critical to have for just a brand presence. That's more of kind of like in the marketing aspect of how the practice and the brand go about doing things. But I do believe it's important. And as you stated, you now have another platform of some kind that you have to go and check to see if a message has even come in, right? If you indeed do have a business page, kind of the catch 22 of the business page, I guess. But the reality is you do want to be present. Our goal for our patients is to meet them wherever they are living already. Why not? Make it as easy for them as possible. Kind of our big, hairy, audacious goal in my whole practice is whenever people get done with us, whatever their experience may have been, whether it was a virtual experience or an in-office experience, is to say, wow, that was it. And if we can do that, we're hitting everything. So kind of to that end, we want to make it super easy for the patient. So Rhinogram with the Facebook business page is critical for my practice too, to have a Facebook business page. Rhinogram integrates with Facebook business page's messenger portion to bring that into Rhinogram. Thus, you're not using your own phone to get into the Facebook page's application or whatever application you're using, or if you're on a desktop, you're logged into Facebook maybe, however you're accessing those messages. Rhinogram simply pulls every message that comes into there into the Rhinogram dashboard as well. So now you don't have to leave Rhinogram. You're getting your text messages into Rhinogram, but you're also seeing everything for Facebook Messenger as well. So you've now minimized one extra login that you got to do in whatever your workday is. And that is most helpful as well. Interestingly, there have been a lot of practices that have had a lot of success doing things inside Rhinogram's platform by virtue of they call these things channels inside Rhinogram. So Facebook's Messenger would be a channel. Your textable business line is a channel, right? So the channels you're using, I've seen a lot of orthodontists having a lot of success engaging, especially with their patient bases through Facebook. I can tell you my practice, 98% of what we do, and it's not necessarily by design, it just happens to be because, again, we are present and we ask people to engage with us on Facebook. But about 98% of the engagements that go on through my practice, through the Rhinogram platform, are text-based. But it also allows us to field those from Facebook. And what's beautiful about that is because they're so infrequent that they are coming into Facebook, we don't have to constantly be looking or waiting or whatever because we can trust that it's going to get in front of our eyes when we're logged into Rhinogram, which is where we're operating every day anyway. So I hope that answers that question. That's a beautiful question, great question, because there's all these things out there, right? Web profiles and everything else they're creating, and brand presence online is a very, very tricky and challenging thing to do. And there's whole hosts of consultant services out there that have built businesses surrounding those things as well, just helping us dentists navigate those aspects of it. To that end, though, and to the marketing end, and maybe I guess the general thought of that question, which is, can I get help for this situation? If you were a Rhinogram customer and you were encountering feelings like that, all you would have to do would be to call your customer success rep, and they would help you understand how to use the platform to make it easier for you and streamline. And that's what I've seen just at every turn with this company. So it's, above and beyond the platform itself, the customer success team, having somebody there when you call them and being able to get in touch with them and helping you work through stuff, that means the world to me. Instead of, sadly, I've had many experiences that I get runarounds, and all that kind of stuff going on. It's very, very frustrating because I just need help when I need help. It hasn't been frequent, but when those scenarios arise, the success team's right there for us.
All right, I just want to say thank you everyone again for joining us. I know we were, a few minutes over, but thank you for joining us. As always, if you have any questions for myself or Dr. Roberts, feel free to text us at 423-800-7644. Everyone have a lovely Friday.